You know, I think I didn't start out as a professional speaker, but I've always loved people. And when I quit counseling to raise my farm kiddos, I kind of was looking for a new space to thrive, in addition to motherhood. And when I came across mental health data back in 2018 in agriculture and realized there was some heavy data that we weren't really talking about, I thought, well, enough people will listen if we can talk about it in the right way. So that's kind of just what I set my goal to do, is to just be a relatable human, a relatable farm family member, and connect with farm families to help make some changes.
And when you connect with an audience, the people in the audience are going to say, well, what do you really know about this? And you probably know more about this than they would ever imagine.
You know, it's interesting because they say when you marry a farmer, you marry the farm.
Right.
I didn't grow up in agriculture, but I certainly dove headfirst into farm life when I met my farmer 14 years ago. But yes, I have a master's degree in counseling. I was a school counselor, so not only did we marry, but our careers kind of married in this advocacy space, because I combined my counseling, my mental health passion, and education with just our life experiences living on a farm and raising a family.
And suddenly you got a chance to apply some of this knowledge.
Absolutely, yeah. And it's been interesting how, back in 2018 is when we first started thinking about how we could make this something people would listen to. My husband and I sat down and said, we've got to make some changes. We've got to do something about this. And really, it was my husband that pushed more than anything, after we saw suicide rates and just information on stress, and just hearing the stories from friends and family members in the farm space, in the agriculture space across the state and even across the country, and some of the organizations that we've dabbled in. It was a picture that we wanted to change, and we wanted to make sure that people knew, whether you're living with a mental health condition or just living with farm family stress, that there were resources and that there were some things you can do to thrive.
And when somebody may be listening to you, whether it's in a presentation or on the television or a radio interview or whatever, how do they really know? Do they really know right away that they need to think a little more deeply about this issue? I have a feeling they probably say, boy, this is a hot topic that applies to me.
Well, I think mental health is a topic that applies to everyone. And I think that's the key, Stu, is that we all have a continuum. Some days are good, some days are bad when it comes to our mental health, and when it comes to the way that our brain works and functions, our happiness versus our contentment versus our low days. We all have anger, we all have frustration and sadness and all these feelings that we aren't so thrilled about talking about. But mental health is really just about how we cope with those things, how we cope with life. So there's a message for everyone out there when we're talking about mental health, and I hope that is over time what we can start to adopt, is this idea that this is a message for everyone. There's pieces of information out there that apply to anyone, and that if you take the time to listen and take the time to make some good changes in your own life, even super small ones, it can really make a big difference.
So how does one start that? Where do you think, instead of just thinking about it, what spurs the action to either make a call or go knock on a door that says help is here?
I've got to tell you that farmers and farm families are some of the strongest people that I know. I mean, physically, they have got it. They push mentally, but picking up the phone to ask for help, I think that's a lot heavier than anything most farmers have dealt with. Same goes for confronting someone that you might be concerned about. So knowing that it takes a lot of strength and it takes a lot of courage to actually take that next step sometimes, that's an important thing to recognize. That said, it doesn't have to be that hard. And we don't have to make it that hard. Like I said, this is for everyone. This isn't just for if you're on the brink of, having suicidal thoughts or something. I mean, that's one end of the mental health spectrum, and getting help and getting professional help and making phone calls, right? But on the other hand, just living a better life is sometimes is seeing the little glimmers in your life, the little pieces of joy when you have days that are super heavy and that nothing's gone right. Seeing my kids get off the bus, or getting done planting a field 10 minutes earlier than you thought. If we can kind of train our brains to latch on to those really important glimmers throughout the day, I think that trains us to be more optimistic and even more realistic about the way we look at our lives.
When your family was looking at these and saying, here's what farmers need to do and think about, and here are the challenges that they need to address, what were some of those issues that are commonplace that a lot of farmers may face every day that they may think, well, I'm not really hurt by this, but they may really be hurt by it?
I think one of the most interesting times was during COVID, at the very beginning of the shutdown, when farmers, when all of the country was told you have to stay in place, you can't mix and mingle, we can't be social, safety is a concern, and farmers said, well, this is what we eat, sleep, and breathe every day. We have one of the most dangerous occupations. We're constantly isolated. We're constantly not dealing, with people a lot. And to some extent, that's an okay thing, right? But on the other hand, after a couple months, when farmers weren't attending their Farm Bureau meetings, or they weren't able to have their Sunday morning coffee and gatherings, that's, I think, where they started to see more of how important that those pieces were in their lives. So there's a lot that goes on, whether it's isolation, whether it's family dynamics. You're dealing with your coworkers being your family members. That's a tough thing that most people don't have to deal with. So there's all sorts of stressors out there that farm families deal with that are very unique, and that the rest of the world, it's kind of a perfect storm of issues.
So where would you suggest someone first start when they realize I need some help? How do they go about it, and what do they do?
I think the first thing that you can do is just talk to whoever you are comfortable with. I mean, even though people may need to meet with professionals, people may need to have some more intense help, the very first thing you can do is just talk to someone that you feel comfortable with. Get it off of your chest a little bit in a way that you're saying, hey, can you be in this with me? It's a little easier to pick up that phone, again, to make those calls or to set up those appointments when you have someone that's kind of cheering you on, or can even physically do it for you sometimes. But even just starting with your primary care physician or some type of medical person that you're comfortable speaking with is a great start, and they can point you then in the direction of finding therapists, finding a psychologist or counselor or social worker, all those professionals in your area. And particularly the Farm Family Resource Initiative is a really great resource here in Illinois, because they do have that farm helpline that you can call, and you don't have to be in crisis to call that number, but they can connect you with people who really understand agriculture, with counselors who have been trained to have conversations with farm families, and can kind of help you go from there to decide what's your best path of either treatment or just getting some support.
Any examples of a success story from doing that?
From FFRI?
Well,
or just in general?
for finding a resolution to this, to addressing the issues and then finding a resolution to it.
I will tell you that at almost every speaking event I go to, someone comes up to me and says, thank you for normalizing this conversation, because without help, I don't know if I would be here, or I don't know if my father would be here, or my son would be here, or my daughter. It's amazing the connection that happens when we start to be a little more vulnerable and talk about some of these things that that stigma still prevents us from doing sometimes. But I hear all the time stories about people seeking treatment, about taking care of their own health, their mental health through treatment, and how it really makes a big difference. Not only that, but I hear stories all the time about how people, again, without a mental health condition, just people who are dealing with stress when they attend some type of motivational workshop or just get some basic stress management skills, just how much improvement their life can make when they take those small steps in the right direction towards finding more contentment.